Hello, and welcome to today's webinar, Enhancing Member Engagement Using Digital and Advanced Analytics. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Ravinder Singh and Janney. Ravinder Singh is Vice President of Data Science and AI at Sidious Tech. He has more than 24 years of experience in the healthcare information technology and solutions industry and has successfully driven strategic initiatives around digital transformation and consulting across payers, providers, and biopharma. Ravinder holds a Bachelor of Technology degree from National Institute of Technology, India, in Computer Science. Janney is Senior Vice President of Healthcare Consulting at Fluid Edge, a Sidious Tech company. He has more than 30 years of experience in the healthcare industry and is recognized as a transformational leader in the areas of technology, operations, and marketing, with a focus on creating economic value for health insurance companies. He holds a master's degree in marketing from Rutgers University, Camden. At this time, I would like to turn the floor over to our speakers. Welcome.
Thank you, Monica. We're looking forward to a engaging hour with everyone. We appreciate all of those that have logged in. Monica, do you want to bring up the first question?
Yes, thank you. As you can see, we have a survey question to kick it off, and I just want to remind our audience that a participation in the poll will require you to make sure you're not in full screen mode, so please exit out of full screen mode in order to participate in the poll. And you can see the poll reads, do you agree with the below statement? Health plans who are adept at consumer engagement and influence will have a distinct advantage over their competition. We have 5 answers to choose from. You can strongly agree with that statement. You can agree with that statement. You can be neutral on that statement. You can disagree, or you can strongly disagree. So once again, do you agree with the below statement? That health plans who are adept at consumer engagement and influence will have a distinct advantage over their competition. And thank you again for participating in the poll. Again, strongly agree, neutral, disagree, or strongly disagree. And remember, in order to see the slide, the poll, you'll need to make sure you're not in full screen mode. So it will appear on the right-hand side of your screen, and you can go ahead and answer there. I'll turn it back to our speakers to discuss the results. Thank you.
I think we should have some Jeopardy music going in the background as people are responding.
Okay, and the results are in, so I'll go ahead and turn it over to you to discuss the answers. We have strongly agree at 60%. We have agree at 34%. We have neutral at 5%, disagree 0, and strongly disagree also 0.
Well, Monica, thank you for doing that. And let me begin by saying I'm glad to see that most of you see the importance of engagement and influence. Otherwise, this would be a very, very short meeting for sure. And yet, as important as we recognize this to be, the healthcare industry is not seen as leading the rest of industries in engagement or influence. Ravinder and I want to share some thoughts about this. I, from a healthcare marketer sort of business perspective, and Ravinder from a strategic delivery perspective. And again, we appreciate all of you that are participating with us in this discussion. So, one of the major challenges that we all face in trying to drive successful engagement and influence is that there are a number of influences out there that are constantly moving our target, right? We know what we want to achieve. We certainly want to achieve closer relationships with our providers and with our members. But our ability to engage and influence providers and consumers is impacted by a number of things. Obviously, it's impacted by political forces. We are sometimes malpositioned with our providers and members by the fact that no politician is going to take on much risk by attacking the health insurance industry. In addition, there are economic forces that are driving this. People see the high cost of healthcare and they struggle to understand why things are so expensive. Providers are focused on just practicing medicine and frankly just want to get paid well for doing it. There's regulatory challenges that makes the target harder to hit. We have federal regulations that we have to be concerned with, some that are directly affect the way in which we can engage with members. We have state and local regulations, all that impact our ability to have effective engagement and influence programs. Then there's just a general industry perception that's out there. A lot of it sort of shaped by media or by political forces, and frankly, by some actions that we as an industry have taken, where we are not seen generally as trustworthy by providers and by members. And so when we think of this, we really have to be mindful of the fact that engagement and influence will be directly impacted by how well we recognize the outside forces that are preventing us from doing this, and how well we come up with programs to deal with those outside forces and try to take some of the momentum back as opposed to having to react constantly to how we are positioned. So again, I'm defining consumer, and certainly I wouldn't argue with anyone who says, well, the consumer is the member or the member that you're trying to acquire. But for the purposes of this presentation, I'm going to use shorthand and refer to the consumer as both the member and the provider, because we have a real interest in engaging both of those parties. And we also have an interest in making sure our engagement and influence strategies work seamlessly between the member and their provider. So as you hear me talk about this, when you see consumer, think both member and provider. So we've been moving towards ever greater degrees of consumer access and controls. You think back to just a decade ago when many healthcare companies were just introducing sophisticated portal strategies and even beginning to get into mobile strategies. Consumers, providers expect us, members, providers expect us to give them tremendous access to their information. And even regulation is driving us in this direction, right? You don't have to look anything further than CMS's FHIR regulations to see that there is a clear direction towards encouraging us to provide more information, more access, and consumers, both providers and members, are demanding it. But what we're really after is to be transformative with this access, right? It's not just about giving people access to their information. It's how do we provide a experience that offers pervasive and preventive healthcare? How do we ensure that that capability is accessible and seamless? How do we ensure that it's a personalized experience that works very well for the individual member and also very well for the provider or the who might be a specialist or a hospital system? And then how do we support the member and the provider's need and desire for better self-management? We need to align our goals. We need to figure out how to align goals with both the member and provider. Now, of course, this is easier said than done. We've all been trying to do that for some time. But to take it to a different level, it begins with us having a deep understanding of what motivates each party and coming up with solutions that are win-win across providers, consumers, and payers. And lest we forget, there are always disruptors at our door, right? The Amazons of the world, the Walmarts of the world, who are very, very focused and very, very expert at engagement and influencing. They do it every day when they get us to buy products on their sites. And my message would be, rather than fear this, can we learn from their engagement and influencing techniques and use some of the technology or the types of technology that they're using by reducing our costs of engagement while increasing the effectiveness of that engagement? I think Ravinder and I would both say yes, that there is that opportunity. And as a retired healthcare executive who has spent many, many years in the industry, I do want to make the point that while we all would be wealthy if we had $1 for every company that came along and said they were going to revolutionize healthcare and they were going to disrupt the industry. We all recognize as experts in this industry that that's very difficult to do. And nothing's clearer than the example of the project where Amazon, Berkshire, and JP Morgan attempted to come up with a highly disruptive model where ultimately they had to abandon it because of just the sheer complexity in driving a full solution. When you think of engagement, I'd ask you to think of it in two terms. There are marketing engagements that are focused on attracting clients and retaining them, but there are also engagements and influence that is focused on how do we improve the experience, both the health experience of our members and the experience between the provider, the member, and ourselves. And so as we've been saying all along, engagement's not enough. Getting them to access us is not enough. How can we be effective at influencing our members and providers in these areas? I wanted to draw your attention to a book that, frankly, I'm a very big fan of. And if you have read the book, hopefully you've enjoyed it as well. But Dr. Robert Cialdini, a leader in the field of psychology and behavioral science, wrote a book back in 1984 that sort of became the standard around influence. And they most recently re-released. It's been released multiple times and millions of copies sold. And I would encourage you to consider some of the areas that Dr. Cialdini calls out as influencers that we need to have effective strategies around, both when we think of our members and our providers. And he's sort of broken down some of the high level areas where influence techniques are effectively used. Things like reciprocation, where basically points to the fact that we're all hardwired, that when we're given a personal gift, that we feel the need to reciprocate in some way. Liking, right? We tend to buy from and we tend to listen to people we like. how can we improve the industry's likability? Social proof. We also tend to look to the people or our social group that we respect to provide us guidance on whether we should be following a particular path or not. Scarcity. People assign greater value to things when they are less available, right? If there's only one donut left, that donut is much more valuable to us than if we see a dozen sitting out there that we can choose from. And commitment and consistency. Once a consumer expresses an opinion, they tend to follow through with that opinion. So how can we use our experience in the healthcare to drive opportunities for reciprocation with our members, opportunities where our members see us in a way that is likable, opportunities in a way where the consumer's social group will also help support us as a good and viable choice and a good and viable solution, as well as leveraging some of the other areas of influence. And again, as I say, if you haven't read this book, highly recommend it, and look for ways in which you could leverage some of these techniques to improve your engagement and influencing. So the final question that I want to raise before I turn things over to Ravinder is, how do we then, so we'll all agree, we need to influence, we need to engage, it's all about coming up with win-win solutions. But how do we create this compelling and coordinated solution for our members and providers, right? That's leveraging both our proprietary data, custom solutions that we've built within our company, maybe best-in-class vendors that we have hired to provide services. How do we create sort of that cohesive, compelling solution as opposed to looking like we're offering a Christmas tree out there that members and providers struggle to make sense of? And for that, I'm going to turn it over to my partner, Ravinder.
Thank you so much, John. Very well summarized. And if we look at engagement is meaningful when we have the capability to influence it. And as John mentioned, the biggest learning that we can get from the digital disruptors is their ability to influence their consumers. And I think in case of healthcare, it becomes a lot more meaningful as well as impactful if, as an organization, we can influence their behavior for them to take better care of their health, which kind of helps all of us in meeting the goals of a healthy community as well as lowering the cost of care. If we look at some of these successful companies who are incumbents and have actually done some pioneering work in this particular space, there are 4 broad learnings that we can actually take away from them. First and the foremost is to look at turning a completely digital model towards engagement. All of us are connected, and after COVID, a lot more connected and a lot more connected virtually. So how can we meet our consumer where they are and at a specific moment of need, when they need, and the need can be anything. It can actually be a logistical that supports them. It can actually be a clinical, and it could be, even in some cases, behavioral. So how do we actually achieve that? The second is, how do we look at a proactive, social strategy? Social and the power of communities is unprecedented in terms of how they can influence behaviors at a scale, not just as an individual, but at scale. Goes very well with long-term, chronic, and also things like mental health kind of areas. So how do we create a social strategy that also gives us a pathway to data where we can exactly know what our patients are doing, feeling, whether it is about their health conditions or whether it is about how we are actually treating them as an organization. Let's look at also, how do we start thinking about finally creating a multi-channel and integrated approach? Consumers have preferences, and those preferences are very strong with regard to, when they would consume that content, when they would actually look at it, and when they can be influenced. How do we actually, make sure that we launch a multi-channel and an integrated approach so that there's a consistent way of engaging and influencing them through the cycle? So that's, I would say, the four broad categories that we can say are key learnings from the organizations who have successfully implemented consumer engagement and analytics in healthcare organizations. Having said that, how do we achieve something like this? Here's a point of view based on our engagements with multiple customers. And if we distill all that learning, there are a couple of areas that actually stand out. The first and the foremost is, understanding the consumer patient journeys. That means how do we identify the patients and what is important to them? It's extremely important for us to understand their behavior, how because that is what will give us the ability to influence them. So having to understand a complete patient journey is the first and the foremost prerogative when we start looking at a consumer engagement initiative at an organizational level. The second is, how do we create a closed loop model? We are proactively thinking about continuously building a understanding of whatever actions we are taking, whether it is at a population level or at an individual level. We're able to create a loop back that gives us a continuous understanding of what is working and what is not working. We need to quickly adapt, right? We can't get everything right. So how do we quickly adapt and kind of launch a more successful kind of initiatives? And then finally start looking at benchmarking it against your own organization vis-a-vis some of the other best-in-class organizations to look at how are we performing from the perspective of, and there are some very good indicators that we can actually look at which can be influencing something like your retention rates, your satisfaction rates, net promoter scores, and also patient satisfaction. So how do we look at that? What we believe is, now how do you get something like this started, right? And you may actually be a payer, you may be a provider or an accountable organization, or it could be a combination of any of these. But if we start thinking about how do we get, where do we start, right? And once we start with uh, a meaningful engagement with our customers, this can be based on what we know today with the available data and understanding the patient journeys. That kind of starts creating a domino effect or a flywheel effect of understanding the care gaps, driving the consumer delight, also allows us to, since now we understand the priorities and what is important to whom, we can actually provide services which are a lot more integrated and makes their healthcare journey seamless. This is one of the biggest challenge we have in healthcare as far as the integration of services is concerned. If you look at the obsession about the patient or being patient centric, it's not new. I mean, our clinicians have been obsessed about their patients. So are the insurance organizations, and all organizations have been actually working on innovating. The biggest challenge has been none of them have come together in an integrated fashion to make it happen, the complete journey for the patient. And that's where the opportunity becomes. And the convergence of healthcare, payer, provider, innovators, and digital now is actually coming together to bring this whole of this to consumers in a manner where it is seamless. And finally, it actually helps lower cost. You have a healthy population, you actually have engaged patients, and then also, they stick around with you as members. So how do we kind of take this into a typical use case model? What we believe across these four areas, there are some very compelling use cases that we can think about. And this, the foundation for all of this is the data. And obviously we may not have the data, but there needs to be a strategy to build the pathways to these new data sets so that you can characterize your consumers and you basically can understand them and understand in terms of how they would behave and how you can influence them. That allows you to now start personalizing your communications. It also starts looking at the right channel in which you can reach and the right kind of a content or an action that you can trigger based on that particular engagement. Starting, once you've started with that, how do you start kind of thinking about the care gaps? And at the biggest one we see in the care gap is adherence, especially looking at the chronic population. How can we drive adherence? And adherence not just from the perspective of whether the medication has been taken, but whether we have taken a holistic perspective, maintaining lifestyle, maintaining behavior, as an adherence, and can we actually drive that? To me, that is actually the most impactful area that we can actually look at from driving outcomes for patients, and also gain simultaneously a better understanding of our consumers. Finally, start looking at personalization of every possible thing that we can personalize for them, whether it is starting to look at the unique needs of care, whether unique needs of outreach, whether unique needs of logistical or any other support that we can provide. Maybe we need to engage the caregiver community or their families in a manner. And then finally start looking at the integration of services. And when we say integration, we don't necessarily need to have only a digital view. I think it's a combination of digital and physical, and a closed loop manner in which you can continue to enrich your understanding of these consumers and members and their needs will actually help us drive the stickiness that we want to create as businesses. Let me talk about some of the case examples where we have seen these kind of strategies playing out extremely well. Here's an organization which actually takes on the riskiest patients on. And what this organization actually does very, very well is basically personalize their touch points, personalize the care to an individual. And this is through, again, using data analytics and AI machine learning. They actually create the different personas as well as the different stratification of these consumers, and then engage them through the whole, the care pathway that these are actually supposed to be. So they segment them, identify them, and kind of personalize every interaction with them. And the whole business model is actually based on risk sharing, and the risk sharing essentially is lowered primarily by their ability to influence and manage these high risk populations. So in this particular case, what we have also seen is that they have actually reduced, using data analytics inside personalization as the strategy, to actually have avoidable utilization and cost by about 30 to 40%, which is huge in case of a high risk population. And this is also through the engagement, which is a continuous engagement of these members, making sure that they are well and they just stay healthy and they stay out, and highly personalized services that are delivered. Here's an interesting journey of another organization, which happens to be a medtech. This is very interesting because in this particular case, this was a complete change in business model that the organization adopted, starting to look at creating a completely new business model from building the devices for diabetes management into a complete value-based care and opening up a new market. The biggest journey lesson that we can get from this organization is they actually started with what they had. They actually had a huge amount of CGM data, and that gave them a good insight. What they could also do is they could actually kind of think a little bit out of the box, and they actually found the adherence correlated to the orders and refills that the patients actually got. on their supplies. And that's where they started looking at in terms of stratifying their patients, looking at their behaviors. And once they hit a particular challenge, they started augmenting that data with the third-party data, looking at EMR claims, and then eventually starting to build over and above that and build personalized engagement models, which are primarily digital in nature, and that gave them access to a completely new market in this case. So this is actually a very interesting case study where you could, once you start understanding your consumers, once you start understanding their needs, there are a lot more possibilities that can emerge. And that creates the control points that each one of us are looking for to actually have our patients and consumers stick around. So that's another case example that I would say where we can actually learn from. So in summary, if I look at summarizing this, the consumer engagement is a function of how well we can understand and influence meaningfully and drive these outcomes. The core to this is actually the data analytics, and now with AI machine learning, this also gives us the power to leapfrog multifolds in driving these outcomes for the members. And as everybody agreed initially, this is definitely a unique advantage that we can create for our organizations as we move forward. So that's, in summary, how I would conclude. With that, I give it back to Monica to run the next set of polls where we can understand a little bit more about some of the aspects.
Thank you so much. As you can see on the right-hand side of your screen, we have actually 3 polls popping up for you to go ahead and make your choices. The 3 polls are running simultaneously, so please go ahead and see them. By not being in full screen mode, please exit out of full screen mode in order to participate on the right-hand side of your screen. And all 3 polls are appearing there at the moment. I'll read the first one. It reads, do you agree with the below statement? My company is an industry leader when it comes to consumer engagement and influence. We have 5 choices there. We have strongly agree, agree, neutral, disagree, and strongly disagree. The next question reads, do you agree with the below statement? My company's consumer engagement model has seamlessly aligned our solutions for members and providers leveraging our proprietary data, custom solutions, and best-in-class capability suppliers. Again, strongly agree, agree, neutral, disagree, strongly disagree. And our final polling question is, do you agree with the below statement? My company's consumer engagement model has seamlessly aligned our solutions for members and providers. Just a second, that looks like a duplicate question. I'll go ahead and pop up these slides for you to see. That's our question that's up there right now. There, my company's consumer engagement model has seamlessly aligned our solutions for members and providers leveraging our proprietary data, custom solutions, and best-in-class capability suppliers. So again, strongly agree, agree, neutral, disagree, and strongly disagree. So those 3 polls will have popped up in the polling area on the right-hand side of your screen. So we'll go ahead and I will turn it back to our presenters, and they can certainly discuss the results. At the moment, we have, for our first poll, our poll, do you agree with the below statement? My company is an industry leader when it comes to consumer engagement. We have 25% at strongly agree, 34% at agree, 19% at neutral, 19% at disagree, and 3% at strongly disagree. So what we're going to do is go ahead and publish all of these, all of the polling results. So just one moment while we let them continue to run. I'll turn it back to our speakers and they can go ahead and continue with their presentation, and we'll post the poll results shortly. Thank you.
John, would you like to comment on the first poll result?
Sure. I'm waiting for the number. There we go. They just popped up right now. So, the reality is we all obviously aspire to be industry leaders. That is our goal. But the reality is that There's a lot of competing priorities that we have to deal with. We have to deal with just the sheer operational realities of operating an insurance company and the regulatory realities of operating an insurance company. So, to see 59% of you say that you're an industry leader, that you either strongly agree or agree, indicate, isn't surprising as much because you're self-selecting to participate and learn more about this particular topic. For those of you that are not where you need to be right now, certainly, my encouragement to you would to say this is never a journey, right? We talked about the moving target that you constantly have to hit. I would say this is never a destination; it is a journey, right? So, for those of you that are not where you need to be at this point, keep at it, keep the focus. And look to, one of the points that I was trying to make in the beginning is look to outside methods of approaching this. We tend to be insular as an industry, right? We think of ourselves as sort of copying what the other larger healthcare companies in our industry are doing. Some of those may be good to copy, but there may be other examples that we can learn through experts like I mentioned, Dr. Cialdini, or like what we see in consumer-based companies like Walmart and of course Amazon. You want to comment on the second question, Ravinder?
Yes, I'm just waiting for the poll results. 1 second, I think I'm.
Thank you. I have gone ahead and published the results for the question about agreeing with the statement below. My company is industry leader when it comes to consumer engagement and influence. We also have the results for my company's consumer engagement model has seamlessly aligned our solutions for members and providers are leveraging our proprietary data, custom solutions, and best-in-class capability suppliers. And we do have a final one that has popped up. And it reads, do you agree with the below statement? My company has made substantial investments in data analytics and tools needed to build an effective consumer engagement and influence capability. So that, again, is strongly agree, neutral, disagree, or strongly disagree.
Yeah.
So we are just waiting for those results to come in.
Yeah. So looking at these results, it appears that all of us agree and that there is a substantial need to make investments and the investments are being made. However, I think if I kind of look at whether we have created the right set of solutions and the proprietary, kind of models by our organization, it still seems that those investments are still to give those returns. And I think, as John was mentioning, this looks like a continued journey that we'll continue on. And I believe a lot of this, when we have spoken to most of our customers, they have actually raised, the biggest concern is around the data gaps that they had. And I believe a lot of investments are actually going towards today starting to look at how do we bridge those data gaps. And the biggest strategy or way to look for this data is with the consumers themselves. And I think those investments that are being made, we believe, are primarily looking for how do we continue to bridge those data gaps. And once we have the right set of data or continue to build on this data, we'll actually see lot more returns with regard to how we can create the proprietary solutions, something which is very, very unique to our organizations that nobody else can do, and then start looking at building the consumer base that is highly satisfied as well as healthy and driven outcomes. So that's how I would possibly look at these results. And as John mentioned, I think there's a huge need that we can learn from other organizations. There's a huge need that we can actually incorporate and make it our own as an industry, and start looking at how do we continue to foster innovation in this particular space. And that's something that we can always start or continue to actually innovate both digitally as well as through the novel engagement models.
And just echoing off of your comments, Ravinder, one of the things that, you know, I again want to emphasize the importance of, and that is frequently companies do not have an end vision in sight of what they're trying to achieve, right? They understand at the highest levels, I want to achieve engagement, I want to achieve influence, but they haven't really gone below that level and laid out the full picture of what they're driving towards. And so what winds up happening is individual divisions, individual departments, individual leaders within the health insurance plan get funding for specific projects, which are, within the line of engagement and influence. But in the end, what you wind up with is what I call the Christmas tree, right? You've got a bunch of bulbs and a bunch of ornaments hung off the branches of your tree. And the while many of those capabilities may be worthwhile, they don't present a clear path to the consumer, to the member, to the provider of how you want to engage with them. They're just a series of tools or capabilities or reports or portals. And so, so again, I would certainly encourage you to identify a leader. Oftentimes it comes as a marketing executive, but I would look for you to have a leader that works across the enterprise, that works with the chief medical officer, as well as the sales executives, to come up with a cohesive strategy that really leverages all of the best in breed technologies that you may build or that you may buy. With that, I think we wanted to turn things over to some questions. So, Monica?
Thank you. And to ask a question, I want you to go ahead and click on the Q&A tab to the right-hand side of your screen. You can go ahead and type your question in there at any time and click enter. We have many questions that have come in, so we'll jump right into our questions. Our first question that has come in, it reads, you mentioned disruptors earlier. This is especially true with digital therapeutics, companies such as Livongo. How is member experience better delivered by such digital companies? For example, I get my diabetic care from Livongo, but I file a grievance with someone else or renew membership with a different plan department. I'll turn it back to our speakers.
Ravinder, do you want to take that one?
Yeah. So what we have seen here is that if you look at some of these digital companies, they tend to be service providers to the payers themselves. While you may actually end up providing or when we look at these, this goes back to the argument of how can we do a service integration? Because in many cases, while diabetes is being taken care by Livongo, the same consumer may also be have a comorbidity situation where somebody else is providing. So when you are actually thinking about starting to look at as a consumer, you will have to start thinking about all the different experiences that they have as an individual, which may be carrying multiple conditions, and then eventually make sure that all of this is extremely seamless for them to experience. So this does require, to some extent, a little more deeper, I would say, integration of experience as well as integration of services, and that's how I believe is the way to go when we look at driving an integrated and a seamless experience for the consumers.
Thank you. Thank you so much. Our next question reads, why does healthcare industry lag behind other industries when it comes to delivering exceptional consumer experience? For example, banking.
Well, first off, our industry is very complex, right? There are a lot of competing interests and competing parties that are involved. And so it's not as simple as just focusing on the consumer being, say, the member, right? We have to come up with effective strategies that the provider also will support, or else we are potentially at odds with the provider, or or in a position where the provider is not supporting the effort that we're trying to do. I think we also, as I said earlier, I think we also tend to be a little more insular in the way that we view some of these things. And the best in class companies really think outside of healthcare and look for influence from other entities that are in businesses that are particularly well known for engagement. And then finally, I think the regulatory aspect of healthcare and the competing competing regulations between state and federal, that in and of themselves generates some challenges for us to be as far along as some other entities. But I think we are, as an industry, committed to this. We certainly are not where we were 5 years ago, and I think we are making steady improvements in this area. And frankly, both Ravinder and I are passionate about this because we see the potential and we see the incremental movement, although it may seem sometimes at a glacial pace, but we see the incremental movement happening.
Thank you. Thank you both so much. The next question has come in. It reads, as a health plan serving commercial, exchange, MA, Medicaid, S&P, I have a lot of different members. How can I deliver consistent experience to all of them?
Do you want me to take that, Ravinder?
Yes, please.
Sure. So the reality is you have to meet each of those members within their class, right? So a Medicare Advantage member, right, or a Medicaid SNP member is going to have very, very different expectations and needs. Obviously, we see this in healthcare portals, right? So healthcare companies have gotten very adept at creating their Medicare Advantage portal, which is more focused on issues that seniors are focused in, whereas their Medicaid SNP portals are much more focused on the underserved communities who need access to care and really helping them figure out how to, maybe even for the first time, obtain access to care. But I want to expand even on that question as well, because it's not just about looking at Medicare Advantage versus Medicaid. Even when you start getting into commercial, right, you have a very different strategy that you should be following for an ACA member, right, versus a member that's potentially attached to a small group or a large group, large employer or national employer. And finally, you may even have some variations of that strategy when you start looking at self-funded versus fully insured members. And so my advice to you would be, think of it in terms of what are all of the member types that I have to deal with? And based on those types, how do I establish a clear vision of what that member needs and what the providers that are serving that member needs within that particular product, and how do I create my capabilities for there? And once you've built that for each of your member types, now looking across all those member types, is there an opportunity now to leverage technologies in multiple areas, potentially tweaking them based on the specific needs of that. But that would be my advice on how to approach that. I don't know, Ravinder, if you had any thoughts on that beyond that, but that's the way I'd approach it.
Yeah, no, I think you covered it pretty well on that front. Thank you.
Thank you. The next question has come in. It reads, matching high-performing providers with certain members is important for us. Should Should we now include ability to deliver care digitally as criteria for high-performing provider?
I'll take that question. So I think it should be. I mean, is there an escape from it at the first place? I don't think there is an escape. Although we have seen, a huge amount of digital care and coming up in the COVID times, and I believe this is going to continue to be innovative. We have seen even the reimbursement models now getting fully aligned towards the digital interventions to something as extensive as cardiac rehabilitation. So I think this particular trend will continue. I think digital acceptability as well as maturity of services is also will continue to be more and more useful and usable by the end consumers. So in my opinion, if you look at matching the performing providers and starting to look at how these can actually be converted into digital areas is definitely a space that we can actually address. So looking at the digital propensity and digital quotient for these will definitely become an area. And I also believe this will help reduce costs eventually for a large set of population and reduce the utilization. So broad answer is yes. And I think there is no escape, and anyway a trend which is getting more and more consumable as well as relatable as we go forward.
Thank you. Another question has come in. It reads, do you think plans will be more inclined to utilize their own clinical infrastructure to pursue an intervention from remote monitoring data, or will they want to integrate the physician to act as an intervention, act on an intervention needed? I ask because what is the greatest value prop for consumer and physician?
So I'll take that, and Ravinder, I'm sure you have thoughts on this as well. The leading healthcare plans have gotten away from the view that we need to build this within our own walls and get the providers to come and connect with us. That was a model that existed 10, 15 years ago. It is not I should say that was a strategic model that existed maybe 10 to 12 years ago. It is not what leading health plans are doing today. Rather, they are trying to partner with the major health systems and the major providers in their area to say, how do we do this, right? And we'll help with the infrastructure. You can help with the infrastructure. We'll leverage your infrastructure. You can leverage our infrastructure, whatever works, right? And the conversation becomes a much more collaborative conversation and a discussion around what can we give you, provider, that will help you provide better care to our members, as well as make your job easier, right? That needs to be the tenor of the conversation, not just what competitive advantage can we potentially gain by hooking up with providers, or what healthcare cost reduction will we drive by hooking up with providers. Those are good things, and I'm not saying to ignore those things, but it needs to come from much more a collaborative approach. And to your point, leading health plans today are really looking at more sophisticated models that integrate directly with the provider. Ravinder?
Yeah, no, absolutely. Fully echo that. And I think also it's also an expertise issue where the expertise lie, right? And I believe it's always better to enable each other as payer and provider rather than trying to even get into a conflict or competing priorities at all. Even from that perspective. So if we look at the trends as well as John mentioned, we do see most of the organizations leveraging and enabling the care providers as the organizations which will actually help them with driving these clinical outcomes.
Thank you. Thank you for those answers. We have one more question that has come in. It reads, can you talk more about member activation? Only 28% of my members use my portal today.
So one of the things I love about portal utilization is it is a wonderful measurement for a carrier to look at and say, how well am I doing with engagement and with influence? If you are struggling to have people sign up for your portal, use your portal on a regular basis, we all would recognize, well, that's an indication of the fact we're not providing yet the value that the member is looking for. And so I would encourage any plan that is struggling with utilization to take a step back and say, okay, what can we do to better understand the engagement that our members are looking for? And those of us that are in the marketing side know it's not as easy as just asking, right? Because members may not know what they want or need, but we have to ask, and we have to ask the questions in such a way that we probe at the real motivators. And we also need to think about it in terms of, listen, we're patients. So we're not only in the healthcare industry, but we're also consumers of the healthcare industry. What are the things that we have experienced as individuals that have been abrasions or difficulties that we've experienced? Those are the types of things that we need to make sure we're providing. And then finally, I would say, this is partly a marketing activity too. How do you get the word out once you know what your members need and want, and you're delivering it? How do you get the word out to them so that they know it's there and they can take advantage of it?
Thank you. Thank you both so much. Okay, I would like to turn it back to you for closing comments so that we can go ahead and wrap up. Thank you so much.
Well, let me, on behalf of myself and Ravinder, first thank all of you all that took this hour with us. And, as I said, we're both very passionate about this topic, as I'm sure you can tell. We'd be more than happy to, continue the conversation with any of you that had an interest. Our contact information is up on the slides, so don't hesitate to send us a note if you'd like to have a further conversation. And if you would just reference the AHIP meeting so that we know where that request is coming from. I'd also like to especially thank AHIP and our moderator, Monica, for keeping us all on track and keeping everything moving. And with that, I wish you all a great afternoon. So thank you all very much.
Thank you, everyone. Thank you for your time.
Thank you to our speakers. We thank you for the great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.